I want to thank everybody for coming this morning. I'm Matt Scher. I'm the Service Line Administrator for Oncology and Administrator for the Tallahassee Memorial Cancer Center. We're very pleased to have you here this morning. And the reason we're here is we're proud to announce that the Sharon Ewing Walker Breast Care Center has received a 3-year full accreditation designated by the National Accreditation Program for Breast Cancer Centers. Definitely worthy of a round of applause for sure. Quickly, I would like to recognize a few people that are here. We have Beth Kirkland, who's the head of the Economic Development Council. So Beth, we're glad to have you here. Also, I'd like to thank Mark O'Brien, who's our CEO. Mark, we appreciate your support in this process that has been about a year-long journey for us. So we appreciate your support and TMH's support of the center as well. And then also, May Walker is here. Where did May go? There's May. May, we appreciate all that you do in support of both the Breast Care Center, but also at TMH as a whole. Joining us today also to expand on really what this means to the Big Bend and this region, we have Dr. Shelby Blank and Dr. Robert Snyder. Both are general surgeons here in Tallahassee, but they are our co-medical directors for the Sharon Ewing Walker Breast Care Center. And then also we have a guest speaker, Chancellor Frank Brogan, who is Chancellor of the State University System of Florida. So again, we thank you for coming this morning. And next I'll turn it over to Dr. Shelby Blank, who's going to speak with you for just a second.
Thank you, Matt. Very briefly, I can't tell you how excited, thrilled, and proud we are that we're standing here having this accreditation under our belts, so to speak. This is essentially the way that the American College of Surgeons designates that a breast center has met certain standards for offering multidisciplinary, comprehensive care in terms of breast health, whether that's malignant or non-malignant disease. And it's a fairly rigorous program, and this is the result of a lot of effort and a lot of support from TMH, and we really appreciate all of the people who took part in this. I'm often asked by patients, do I need to go somewhere else? That's kind of the first question. They want to make sure when they have a new diagnosis of breast cancer that they're doing absolutely everything that they can to have the best result that they can achieve. And so their first question often is, do I need to go somewhere? Do I need to go to a tertiary center? Do I need to go across country? And it's very exciting to be able to tell them, you're at a center. And we've measured ourselves with a yardstick against centers all over the country, and we're offering the most cutting-edge, multidisciplinary approach, and it's right here in your own backyard, and you don't have to travel to achieve that. So that's something we're very proud of, and we're very happy to be able to offer to our patients throughout the region. I think that, again, Dr. Snyder will add to this, but the things that we looked at were not just surgical, they were not just oncologic, they were not radiographic, but the idea of a true team approach, so that for every patient that has breast cancer, you have a very comprehensive team that's sitting down, discussing that patient individually and coming up with the right individualized plan of care. And like I said, we're very proud of this, and we're very thankful to all of you that took part, and thankful to you for coming today and helping us celebrate. And I will turn things over to Dr. Snyder.
Thank you. Yes, I'm Dr. Robert Snyder, and the subtitle for the ad where you see the Cancer Center with Dr. Blank and I is The Beauty and the Beast, if you hadn't noted that. I'm a general surgeon here for over 33 years, and I've seen an amazing evolution in breast cancer care here in those 33 plus years. The gold standard in the late 70s, everybody got a mastectomy. Women went to sleep with a breast lump. They didn't know how they were going to wake up, and it was sometimes not a very happy experience. That's all changed. First landmark change is lumpectomy. with breast preservation in the early 1980s was proven to be equal to mastectomy for cure rate and survival with early detected small breast cancers. Second landmark, by the way, a large number of these breast cancers that we find nowadays are indeed small, and I'll cover that in just a second. Second landmark change was improved imaging. Increased numbers of women through so many public programs, et cetera, publicity, so many more women are having mammograms and ultrasounds. It's an amazing increase in rate of that. That has led us to, once again, earlier detection. Third landmark change is image-guided biopsy. This has essentially replaced the old-timey open surgical biopsy. Through mainly our radiologists, we do stereotactic guided biopsies, ultrasound guided core biopsies, MRI guided biopsies. All those disciplines are available right here in Tallahassee, and they're done well. With these image guided biopsies, we have a lot of preoperative information that we didn't used to have. There's not a whole lot of guesswork when the patient goes into surgery, so they frequently know exactly what's going to happen for them as compared to 33 plus years ago. Fourth landmark change is vastly improved radiation technology. We have our new cancer center. All that technology is available right here in Tallahassee. And lastly is ever-expanding chemotherapy options. We're getting so sophisticated there is that a lot of patients have tailor-made chemotherapy specific to their tumor. All this is also readily available here in Tallahassee. So, with this state-of-the-art technology, we're diagnosing women with breast cancer earlier than ever before, which statistically improves our survival rates. And this is really good news for Leon County because we actually have a higher incidence of breast cancer than the state in general. Fortunately, with the increased number of women receiving mammograms and breast health program and resources, we continue to help improve our community's breast health through education, regular screenings, and early detection of this disease. Thanks.